Good evening, everyone, and welcome to our session. I am Dr. Tarinee Puri on behalf of Voice of Healthcare, and I welcome you all to yet another session of Blue Wave of Change, Navigating CRC Awareness Together, supported by Dr. Reddy's Labs. This series aims to raise awareness and provide comprehensive insights into the various facets of colorectal cancer. Through a series of engaging panel discussions, we aim to address critical aspects such as early detection and screening strategies, highlighting the importance of timely identification and also discuss some common misconceptions and barriers. The topic for today is enhancing colorectal care beyond urban centers. And now, I'd like to welcome our esteemed panelists for the day. Dr. Brigadier Rajeshwar Singh, Director, Medical Oncology, Paris Hospitals, Panchkula. Good evening, sir, and welcome to our session.
Good evening.
Dr. Poulami Basu, Consultant, Medical Oncology, NCRI Hospital, Kolkata. Good evening, ma'am. Welcome to our session. Dr. Pushpak Chirmade, Consultant, Medical Oncology and Hemato-Oncology, Oncura Cancer Care, Kokilaben Dhirubhai Ambani Hospital, MGM Hospital, Jupiter Hospital. Welcome, Doctor. Dr. Srinivasa BJ, Consultant, Medical Oncology, HCG Cancer Center, Bangalore. Dr. Sushant Paikray, Senior Consultant, Medical Oncology, HCG Hospital, Bhubaneswar. Welcome, everyone. And without further ado, let's begin our session. So, to set the tone of the session, I'd request Dr. Rajeshwar to give us his opening remarks and a brief on colorectal cancer with an emphasis on the status of CRC awareness and care in rural areas.
Thank you. First, at the outset, please excuse me. I've got an asthma attack, so I may be coughing in between. So basically, colorectal cancer is less commoner cancer as compared to the other big three cancers, that is breast, cervix, lung, and oral cancer. So the number is lesser in our country as compared to Western countries. More so, it is lesser in rural areas as compared to the urban areas. So reason being that there is a dietary pattern change in dietary pattern in the urban area, which is still less prevalent in the rural areas. And especially the diet is very, very important in colorectal cancer, especially the fast food, which is there. All two-tier cities, all urban centers have got this sort of McDonald's and pizzas and all those things. Children are not eating their normal diet, which were a usual diet of full of vegetables. Non-veg is generally not used in villages as compared to urban area. So incidence is much lesser in rural areas as compared to the urban area. Then there are the factors apart from the dietary factors. Other factors are that the alcohol consumption, which is again important, cigarette smoking, and exercise, lack of exercise. These are the things which are important in colorectal cancer. There are certain genetic factors also. FAP is one, Lynch syndrome, and where you have to do MMR testing is required to be done. And but they are very common, counting not more than 5% of the cancer. So this is the epidemiology as far as the awareness is concerned. Awareness, I'm sorry to say, the awareness is very less of colorectal cancer, especially in the rural areas, because no screening is done. Ideally, the screening should be done and it should be taken by the government, because affording of screening test is the problem. All Western countries, the screening tests are free of cost, but in our country, screening test is not there, and they're very easy screening test in form of colonoscopy and distal rectal examination, which can easily detect early, which should be done after 50 years. Or nowadays, Western countries, they are starting 45 years, because there it is very common, which is dietary related, which is much lesser in our country. The rural area, the problem is the myths also which are there. The myths that firstly they don't want to get the test, कहीं कुछ निकल ना जाए. Firstly, all the ladies say हम test नहीं कराएंगे, कुछ निकल आएगा. Secondly, you see the quacks and they are there who will treat and delay the diagnosis, and by time they come, it is very advanced stage and difficult to treat. So financial issues are there in rural areas, though country is improving, but still it is there. They hardly spend anything on their personal medical needs, rather than taking 2 3 square meals in a day. So this is the condition in you see rural area. Things are not as bright as urban area.
Thank you, Dr. Rajeshwar. So, like as you mentioned, diet. Could you also elaborate on certain dietary habits that one should take in order to prevent colorectal cancer?
Yeah, the thing is that we should eat green leafy vegetables, which was used to be a staple of our country some time back, and people are going away from that. Full of vegetable, that is one part. Secondly, avoid meat in all form, if possible, especially preserved meat is there. Then, apart from that, alcohol and cigarette smoking should be avoided. These are the things which are in dietary, which are important for colorectal cancer.
Thank you, Dr. Singh. Now I'd like to address my next question to Dr. Srinivas. So, as already mentioned or touched upon stigma present, could you elaborate upon what kind of stigma is there and what kind of awareness might be required, in your opinion, to um, you know uh, prevent the stigma around colorectal cancer?
Yeah, so colorectal cancer stigma, I think most probably awareness itself of colorectal cancer may not be there. For example, if we take the example of breast cancer, or if we take the example of cervical cancer, there they have maybe some awareness may be there, and because any lump in the breast, they may see that it may be cancerous. So that stigma may be there, that they cannot go and um, uh, uh, tell to their family members, or going to the doctor, fearing about the cancer. And even for the cervical cancer, if there is a bleeding per vagina, so they may also have the fear of cancer at the elderly age. But for the colorectal cancer as such, because most of the symptoms are the bleeding per rectum, this may be related to the fissure, piles. So many reasons are there. So I think most of the people may not be knowing that the colorectal cancer also cause bleeding per rectum. So that is the myth, I think most probably they may have, and I think that is the misconception. So that is why they usually go to the nearby alternative medicine doctor, or some of the quacks, and they get some Ayurvedic medicines, and somehow it get controlled. And suppose there is a cancerous growth in the rectum or in the colon, so it get neglected, and they usually present with uh, in the advanced stage. I think that is how. And to break the barriers, I think once again, I feel the more commonest cancer, breast cancer, and the cervical cancer itself, the people are not aware, especially in the rural area. We have to create the awareness.
Okay. I believe there's some technical issue with Dr. Srinivas. So I'd like to move on.
Disease of this colorectal
Yes.
cancer. That is what
Hmm.
I feel. I mean, by educating the by social media campaigning, or community programs through the primary healthcare centers. So that is how we can reach to our rural populations. That's what I feel, madam.
Thank you, Dr. Srinivas. Now, moving on to our next question, I'd like to address that to Dr. Basu. Could
Hello,
you touch?
I'm not able to hear you.
Hello, am I audible?
Hello.
Hello, am I audible?
I think there's some
Can,
Just
local
relog in
problem.
once again. 1 minute.
can everybody hear me? The panelists?
Yes, we
Yes,
can
yes.
hear.
Okay, perfect. Okay, so yeah, as I was saying, so my next question is to Dr. Basu. I would like to ask about how the treatment status in tier two, tier three cities, and how tier two differs from tier two, tier three cities, and even a difference in terms of the tier one cities. How are they different? And how's the infrastructure of treatment different in all these different tier cities?
Okay. Okay. So whenever a colon cancer patient comes to our OPD, first of all, we have to categorize either means it is a localized disease or it's a metastatic disease because the entire treatment depends upon the stage. If it is localized, non-metastatic, then we have options of mainly the treatment option is surgery. And in that case, I think the survival is more. We are here for awareness. Why? Because if we can detect early, so we can means cure the patient, because in that case surgery is the only treatment option. But if it is metastatic also now, then nowadays we have more options of targeted therapy. We have options of anti-EGFR, anti-VEGF, bevacizumab also, which we can use in a stage 4 also. So we can say that colon cancer is a cancer, in spite of means having higher stage, we can treat them, and we can maintain their quality of life. We can increase their survival. But the major disadvantage is a financial constraint, because most of the patients are not able to afford anti-GFR therapy like means panitumumab or cetuximab. If means they have some, usually we do this KRAS testing. If it is wild type, we have options of this targeted approach, right? But because of this higher cost, most of the patients are not able to afford it. So I think it's an issue. And secondly, I can say that if the patient present in a very higher stage also, if affordability is not an issue, we can treat with chemotherapy along with this targeted approach, so that we can increase their survival as well as we can increase their, I mean, we can improve their quality of life also.
Um, so, ma'am, can you also add a bit on the insurance side, or how this reach could be enhanced, or what certain schemes might be present, or what need to be done in case of affordability of these treatments?
Actually, most of the patients have means they are from a very poor socio, like means any sort of targeted therapy. Even bevacizumab sometimes is possible, but cetuximab or panitumumab is not possible to afford. So I think cost is an issue. Yes, we have some PAP support program. Means 1+1 is there, but in spite of that, there are some financial constraints. So in that case, we just continue the main chemotherapy. We usually use the capox regime for colon or in colorectal patients, and the result is good. But if we can add these targeted therapy like anti-EGFR or anti-VEGF, we can increase their survival.
All right. Thank you, Dr. Basu. So, my next question would be to Dr. Sushant. Could you add a note on how technology could be leveraged to reach the rural population in terms of
You are on
awareness?
mute, I think, madam. You are on mute. We are not able to hear you.
Hello, can everybody hear me?
Hello. Yes, yes, I can hear you.
Yes, we
All
can
right.
all hear you.
Yeah.
I'm not able to hear
So,
you, but other speakers I'm able to hear. I think. I don't know.
um, all right, I'll just check that. So, my next question would be to Dr. Sushant. Could you add a note on how technology could be leveraged to improve the accessibility to treatment, to even improve awareness in terms of colorectal treatment?
First of all, I want that the previous question that whether the tier two city has anything the people from the tier two city is able to get the all the treatment or not. So the thing is that to address your question, the technology how it is improved, that because of internet and all the things, we all, even if we are practicing tier 2 city, we all updated about the things what happens in the uh, other places, what new drugs comes to the for the oncology treatment. So we all updated. And one thing that ma'am addressed at the previous panelist addresses, that affordability is a issue, no doubt, because purchasing capacity of the number of people of purchasing capacity, that definitely lesser than tier 1 city, but the things, the accessibility, the availability of drugs, all that the things are available in tier 2 city. Another thing how technology helps in tier 2 city also, that by this like these webinars and all the things, and there is many regional channels, TV programs, and through hospital we also going to the interior of the state, and we are visiting the our out we have outreach OPD. Then we may take teleconsultation from the remote area by sitting in the capital city. So by this technology, we can help the patient. Nowadays, everybody having mobile phone, so that our messages can be spread across the state and also along the remote area. So definitely the technology helps to create awareness and for the treatment and the availability of the infrastructure and resources.
Would you also like to add a note on how the digital India mission or digital health mission, how that has contributed to improving the accessibility in rural areas?
That digital the thing is that that in my OPD I am practicing, I keeping my records, all the records digitalized, so that even if I see any patient in rural area also, I kept all the documents with the patient database, so that even if rural or it may be the city patient, so we can access the data by that also. If you see a patient in rural area and he come to your OPD without any documents, then you have digital data. So digital health mission is definitely help to all the in across the country, whether the people from the village or the cities. So it helps definitely keeping records, and it helps us that always that people tell us, some people tell us I come to your OPD, but by the way, the in the bus, the it is their documents are stolen. So that by this digitalizing everything and digital health mission, all the things help us by keeping our records properly, because documentation is one thing is important for the treatment of the patient. So by keeping digitalized all the records, it helps the all the population to our country.
Thank you, Dr. Sushant. So, my next question would be to Dr. Pushpak. Firstly, welcome to our session.
Hi, am I audible?
Yes, you're audible.
Yeah, tell me.
So, my question to you would be, what strategies? So, we have been discussing about certain all the challenges in the rural areas regarding the colorectal cancer awareness and treatment. So, I'd like to ask you that, according to you, what strategies can be employed to ensure affordable and timely access to colorectal cancer medications in tier 2, tier 3 cities, and taking in account the economical disparities and potential barriers to drug availability.
Okay, so the important thing that I feel is between there is a knowledge gap
in the tier 2 and the tier 3 cities, and this knowledge gap is the biggest challenge. So people present late. The accessibility to treatment is also something, or even the diagnosis, accessibility to diagnosis is even challenging, and that is something that we should improve upon. Uh, Normally, what happens is that because there are poor access to diagnostic facilities or proper guidance, the patients keep on ignoring their symptoms or are misguided or are not finding the proper channel as to how to get it treated. And in this, we lose time and the TCs gets advanced, and that indirectly compromises on your outcomes. So, in tier 2, tier 3 cities, I think the biggest thing is to bridge the gap. One is for the diagnostic facilities, second is for the awareness of the patients, that they should be aware that if they have these symptoms, they should immediately go and consult a proper qualified, say a cancer physician, oncologist, so that they are better able to take care of these patients.
All right. Thank you, Dr. Pushpak. My next question would be to Dr. Rajeshwar. So, as Dr. Pushpak mentioned, bridging the gap and reaching out to doctors, and in your first answer, you mentioned a lot of quacks. Could you talk about how what strategies could be employed to maybe train or prevent these quacks, or train the general physicians there or the healthcare professionals there to diagnose the disease on time and not miss on certain indicators and refer timely till the time the infrastructure is ready?
Yeah, I think this is the most important part of, awareness. Now, awareness problem is that we all think that awareness is a doctor's responsibility. No, it is not doctors. It has to be through NGOs, and the national policy should be there that awareness of cancer, that they take it to the last man, on the road. So it has to be from the national this thing, and we have to train the. Now you see, if every district is hospital has got a medical college, and of course the reach is become very less as far as medical cancer of colon is concerned. So they have to be informed that they through telemedicine is. They should contact the local oncologist through telemedicine, which is important in this. And unless we train those this thing, and the NGOs and the government and non doctors, they have to put their bit into it for awareness. Awareness is not doctors' responsibility; it is the society which has to bring out the awareness of this. And thirdly, now you see, everyone has got a card, health card, in every rural area. You can have a good quality treatment for some at least 5 to 6 lakhs, which is probably going to increase in couple of years. Apart from that, we have to ensure that we have to ask all individuals that at least they should have some medical policy. 5-10,000 is not very much. They can get a policy of 5 to 6 lakh in this amount. So these things and awareness by NGOs, by government, and they have to through medical college, because now medical colleges are at the doorstep. So they can easily go to the rural areas and send their people, and they can have a awareness about this cancer. So we can reach the last man. It is not now possible to reach. Roadways are good, so I mean it is not what was there 10 years back or 15 years back.
Thank you, Dr. Rajeshwar. So, building on what Dr. Rajeshwar said, my next question would be to Dr. Srinivas. Am I audible, doctor?
Yeah, you're audible now.
Right. So now, as we are discussing the NGOs, the public organizations, would you like to add a note on how public and private partnerships, specifically maybe even the pharma companies or the diagnostic companies or the hospitals, they could combine and collaborate together to improve the reach, accessibility, and even for that matter, awareness for colorectal cancer?
Okay. So I think mainly because now social media access is rampant, even not only in urban cities. I think even in rural areas. I think most of the NGOs and the private firms which create awareness for this. I think they can reach to the rural community through the social media, because most of the people, even in rural area, they have access to smartphone. So apart from this, I think as I have told earlier in my statement, that usually the primary healthcare centers, through primary healthcare centers, which are easily accessible to most of the people in rural area, especially the community centers. So their community awareness, putting a banner, doing a role play, and distributing some I mean, some paper information regarding this, the booklet regarding the colorectal cancer, and in their own languages, in their own languages like Kannada, Tamil, Telugu, whatever in the regional Hindi. So in the regional languages, we have to distribute these things, and I think. The pharmaceutical companies, I think most probably they can come with the public and government organization and private organization by helping getting the colonoscopy done, which is a screening program for most of the to detect the cancer early, especially those who are already having the colon cancer and they are obese people. So I think they can give some colonoscopy help. I mean, especially in the budgeting that the colonoscopy getting to the rural population, and also nowadays fecal test to detect the cancers, as though it is not that much widespread. I think these things can also be they can partner with the pharmacy, I mean the diagnostic companies, and they can bring for the screening program. And I think government should also give some subsidies to fall these on the diagnostics test. I think this is how I think we can close the gap for the affordability and reaching the people, I think, most probably.
Thank you, Dr. Srinivas. My next question would be to Dr. Basu. Um, can you hear me, doctor? All right. Okay. Um, okay, I'd like to address my next question to Dr. Sushant. So we have been talking about technology and how it would improve the reach. So could you also elaborate on how proper awareness needs to be made in rural areas to use technology properly, whether it be internet, whether it be telemedicine, or whether it be any source of information available? Could you touch upon that?
Yeah, definitely technology also help. But one thing we taught in our medical education, that the person to person interaction is very much effective. And when there is a restriction or anything, you may not afford the time. At that time, that you can use internet, that you can do video conferencing, so that you can give some speech to the gathering through a internet. And by the internet, that in Odisha, our government also doing the schools making that the availability of computers and LCD screens in every school, so that you connect to the through you can that like you asked the previous question, how government can create the awareness by this thing. If government wants, that select some doctors expertise on cancer, so that they can awareness about tobacco, quit tobacco, so that they can in school education, they can aware about how to quit tobacco, how tobacco is injurious to health, how tobacco causes cancer. So that by like online studies, some few doctors can give lectures on the about tobacco related cancer, about colorectal cancer, how what are the symptom of the colorectal cancer. By this thing, we can touch upon the at one time, we can touch upon many areas of the state, remote areas of state, and in the regional language. And by this government's help and the technology, we can aware our rural population. Also, the growing population, like the children's, adolescent, teenagers, and the college going students. We can aware of them that okay, no, this is the things you have to do, and what are the things what not to do, like that.
Thank you, Dr. Sushant. Now, my next question would be to Dr. Rajeshwar. Doctor, can you elaborate? So, like we have spoken about what we should, what different associations, agencies, government, etc., should do. But could you elaborate on what you think would be a challenge while educating the rural population? I mean, are they more accepting towards change, towards technology, all these things, or not? And what challenges you think that could occur, and what should be done to tackle them?
You see, awareness of cancer, when you want to do awareness, doctor cannot go. Doctor can see 20 patient, 30 patient, 40 patient. But cancer awareness is a whole population has to, you see, come to know about what are the effects and side effects and whatever it is, how the cancer occur, what are symptoms. So for whole population, doctor cannot do. It has to be social media. We have WhatsApp. Everybody has got a WhatsApp in this. The NGOs and government should take lead in this. They should keep messages, passing messages rather than passing stupid messages. These messages that what are the signs and symptoms of cancer, how you can do, what are the risk factors, and how you can prevent and all those things. So in this media is now everyone in everyone's pocket, everyone's hand, and smartphone is there. So that is where, or the government has to take the lead in along with the NGOs for awareness, because the doctor can see only 10 patients, maybe 100 patients, not more than 100 patients will be there. But when awareness is there, or screening programs are there, screening programs are the mass programs. India, they have not started because the cost is very high. So in Western countries, only screening is done, and screening is done for everyone there. You see, everyone undergoes screening, not few patient or one lecture and 20, 200 or 300 patient. So in this NGOs as well as government through social media, we have a smartphone in our hand. From that, we can make them aware of what are associations of colorectal cancer or this, and how to prevent it, and take forward from that. So it is more of, and then of course the rural doctors, they have to be involved in this awareness, apart from the uh, any specialist doctor, because I feel that specialist has got no role in cancer awareness or doing what you call as screening test.
Thank you, Dr. Rajeshwar. So now, before we conclude the discussion around this, I would request both our panelists to give their closing remarks in terms of one message to the audience, one experience, because we have realized that our viewers, they imbibe the doctor experiences a lot. So if they could give one message, one experience that they have had, so it would be really helpful. So I'd like to start with Dr. Srinivas.
Yeah, message is colorectal cancer, though it is very less common in India. But recently today, I was reading the Times of India newspaper, where they have seen that, including the Western countries and even in India, the incidence of this colorectal cancer is increasing in the earlier age, maybe around 30 years, 40 years of age, including colorectal cancer, almost 29 cancers. The epidemiology has changed into the earlier onset of age. I think that is why, whatever the cancer for that matter, whether it is a breast cancer or cervical cancer or colorectal cancer, any symptoms, especially for the colorectal cancer, any bleeding per rectum is there. So they should get evaluated with their medical doctor, nearby doctor, and get a, I mean, in-depth analysis of that before being neglecting the symptom. And also And also some of the patients we get, especially the colorectal cancer can present with only the anemia, weight loss, and black colored stools, which most of the people will not able to notice that, and they will present with just weight loss and tiredness. And on a further evaluation, we will come to know that it is the colorectal cancer which is advanced, or it may not present with which it may not present with the bleeding per rectum or altered bowel symptoms as such. It may present with anemia and just weight loss in especially the middle age group. So I think that is what we see clinically in our clinical practice, and also in earlier age. Recently, I was seeing younger women. I mean, 27-year old female diagnosed with colon cancer, coming with after surgery to for further treatment. I think the symptoms should not be neglected, and any anemia, any tiredness should be thoroughly evaluated. That is what the message for most of the colorectal cancer awareness month for me, from me.
Thank you so much, Dr. Srinivas. Now, I'd like to ask Dr. Rajeshwar to give his closing remarks and experience and a message for our audience.
Yeah, I mean, this was a good discussion. Basically, we want that rural areas have to be targeted because, uh, you see, my message to them is that we should not leave our traditional eating habits, which included plenty of fruits and vegetable and minimal of meat or meat preserved this thing. Because, and of course, the diet should also not include the junk food which we're eating. We had a very less cancer because our food habits were good. Apart from that, we should have a regular exercise because even obesity is a risk factor for this cancer. So if we stick to these two things, we can prevent a lot of colon cancer. And then if we have any symptom, they should early report to the concerned any doctor, local doctor, who can then take care of the further needs of that patient. And thirdly, they should have that card, insurance card, and they should have their own insurance of 5 to 10 lakh if feasible, because if God forbid they get this disease, it is slightly expensive to treat. So these are the 3 points I want to give as a message for today's conference. Thank you.
Thank you so much, Dr. Rajeshwar. So now with this, firstly, I'd like to thank our panelists for taking out time for this discussion. Dr. Rajeshwar, who joined, who spoke and stayed after the asthma attack. Thank you, doctors. And now I'd like to also thank our viewers for staying tuned in, for asking questions, etc. So stay tuned for our next session and have a good day, everyone. Thank you.
Thank you.